Good morning, everyone. So today, let me discuss a paper entitled "A Public Platform for Virtual IoT-Based Monitoring and Tracking of COVID-19." Authors are as follows: Yunchan Jung and Ronel Agoto. Now, let us start with the abstract. As we all know, coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered coronavirus. Until now, different countries all over the world is trying to look for at least solutions or how they will alleviate the impact of this coronavirus. Right now, the world is developing an app that will alert any smartphone or my smartphone when COVID-19 confirmed cases, for example, comes near me. However, regardless of what we will put into practice use first, a, a tracking system or a COVID-19 tracking system should at least satisfy different issues. Somehow, those issues are under the legalization of location tracking and scalability as a public platform which will be used all over the world. Also, additional problems need to consider. This problem yields related to the real-time authentication for information gathering, blind naming and privacy of a tracked persons which will be monitored, and at the same time, the quality service on the query reply procedure. Actually, this paper proposes what called as the software-defined networking controller-centric global platform to monitor and track information for those which are relevant people under COVID-19 and provide at least a real-time information disclosure services to the worldwide Center for Disease Control and Preventions and regular users. All over the world, each of the countries represents by their central and for disease control and preventions. They all have their independent applications or solutions on how they can monitor COVID-19. But right now, there is no universal application somehow that this Center for Disease and Control Preventions institution could share and disseminate informations regarding their customer or their patients' informations that could somehow be useful in monitoring and tracking COVID-19 all over the world. Particularly, the CDC also manage a list of peoples who need to monitor related to the COVID-19. The proposal would somehow possibly install what we call as the COVID-19 Virtual Internet of Things or VoIP, which is in the form of an application or a software into each of our smartphones. In addition to this BIOC, it also supports nodes which will engage as information provider to all nodes or smartphones part of our network configuration, which will then somehow improve the quality of information services. The design of our platforms aim to ensure confidentiality and authentication services, which will give individually part of the network what we call as this secret key. In addition, our platform will meet system scalability and reduces query reply latency, where the platforms will accommodate bigger or a larger number of worldwide CDC and persons in control per CDC of our network. For the introduction, the world is now developing an app that will alert my smartphone when a COVID-19 confirmed cases is within 5 meters of my location. Because as we all know, the closer you are in the COVID-19 patient, the risk, the greater or the bigger the risk that you will be infected. This application will somehow use the technology of either the distributed method or decentralized method. Actually, it is not difficult to be part of what we call this distributed warning network. Now, first, let us look at the distributed method. If we place into a decentralized application on our smartphones, it means that we are part of that network. We are participating as a member of the distributed warning network. And we will call as a nodes. Basically, when we downloaded one of the distributed warning network, we can either use the web, install the program, and then find and connect at least one of the other node belonging of our network. When we will be part of the network, we will be the participant or a part of those nodes. Let's say suppose that my smartphone has joined a configuration node of this what we call this distributed warning network. So I will call myself as node A. Now for me to see if there are any COVID-19 confirmed cases around me, I can actually just hit the corona keyword, or I can type in corona, and then using this and supposedly my current location and basically this keyword information, it will be sent through the other node. Then me as a node A will send the query message to the nearest neighbor node. And then once they receive this message, as part of the neighbor node, they will search through the information that I send and compare it with the information that they are currently holding on. And then they will inform me, or they will inform the node A with the corresponding information based on the parameters that I sent. Then it will send the query request to the other node as part of the network. This query message will spread through the network as the wave spreads by repeating the same process all over the part of the network receiving this. As a result, only one query message can quickly spread to thousands of smartphones which are currently connected through that configuration node. And any parts of that network or node that will receive the replied information about the presence of the COVID-19 cases informs me of this information. Then anyone can use the information that the other people know. And then this information will be stored when I need it. Actually, the key here is how we will handle the source of information. A person who is a confirmed COVID-19 cases who informed himself of his location has a problem in participating this what we call this distributed warning network and acting as a source information provider. If I will be a COVID-19 confirmed cases, I might double think if the application or if the network that I will join is really secured in handling my information. Would it basically confirm or handle the confidentiality of a person? On the other hand, the operations of what we call this decentralized application is smooth. In particular, it is easy for the government to manage it. Actually, a large number in the center will keep track of all the COVID-19 confirmed cases and their location. Actually, if you are part of a centralized application and you want to track your current location, if you want to see if there is any COVID-19 victim within you, the central computer is ready to provide that information. That is what we call in the form of a client server type of web services. By then, it has the advantages for this kind of application to establish a repository or a database dealing with the centrally forced COVID-19 confirmed case list, together with their current location information. However, a bigger problem might be considered also, like privacy concerning to this bigger kind of problem. The centralized application or the centralized approach has to solve this kind of problem. Currently, institutions such as Apple and Google are jointly developing this app, which seems to prepare a distributed method rather than a centralized kind of application. At the same time, pan-European privacy preserving proximity tracing, or the PEPPT, is said to have already developed a centralized approach. We can look on this reference for this kind of application. We will see what we will be put to practical use first, either safety or privacy or confidentiality. This paper places a point on the following issues, particularly 7 issues to develop the worldwide public service system of the COVID-19 relevant information that the ordinary users, as well as the Center for Disease Control and Prevention (CDC) institutions, use together. What are those different issues? First, legalization of location tracking. In South Korea, large-scale diagnosis of COVID-19 suspects and the unveiling of a full moving line of COVID-19 19 confirmed cases surprised World Health experts. Actually, in 2015, after the MERS Middle East Respiratory Syndrome disease or crisis, South Korea institutionalized tracking the path of the infected persons. Since then, it is now possible for the government or the health authorities to use the location or the information without their concern or consent if it is necessary for preventing information or infection. It is essential to establish a location tracking system based on the safety plates to track the suspected legally. This paper is based on the following legal aspects. The Center for Disease Control and Prevention, or CDC, which will manage a list of people who needs to be monitored related to the COVID-19 and possibly install virtual Internet of Things or BIoT nodes in the form of applications on their smartphones. Second issues, public platform used by the world. In the unpredictable circumstances of COVID-19's cause and development, organizations operating under secret central control, which somehow hide some information, have exposed instability and failed to help overcome the COVID-19 crisis. Secrecy and authoritarianism may be useful in preventing the explosive distribution of false information, but they cannot contribute to the spread of viruses effectively. Therefore, the transparent and open CDCs should manage infected suspects. However, they still make their tracking information public locally and individually. Consequently, it is necessary to build a global public platform that can capture them. The issue is real-time authentication and reliability of information. Right now, there are also a few countries that handles less confirmed cases. As we all know, even though Singapore and Hong Kong announced they have at least fewer than 100 COVID-19 confirmed cases, there was civil unrest. They still implement strict protocol. They still implement lockdown or other parts of their countries. However, there have been this no such kind of situation in South Korea. Despite the number of surges that they experienced in confirmed numbers, South Korea was able to maintain stable social functions even when the number of infected people reached their peak all throughout. The main reason for this is that the South Korea's Director of Disease Control and Health authorities have given them at least a detailed and transparent briefing on the information all over the time. This somehow gives them confidence that they are in the control of the situation. However, this kind of process which can said that they gave intelligence briefing once every 24 hours as frequently as they can could be somehow in the form of era of offline newspaper before. The background of releasing information every 24 hours is the product of the era of offline newspaper. Information should at least be collected immediately. We don't need to wait at least 24 hours before we will tell our constituents over the status of COVID-19. When in fact, ordinary users can request this kind of information they need. And at the same time, as a real-time authentication, there should be a network which can be somehow disclose the services of the information as fast as possible. For these services to be successful, the information collection department or institution or the controller and this authentication should occur at the same time. In addition, the reliability of the newly collected information must be able to be proven in real time. Next is blind naming of infected persons. Aside from the real-time tracking of confirmed cases and suspected information, it is possible now because every one of us has a smartphone. It is easy for us to connect to the internet or to search how many of the infected person exist in a certain countries or where will I be in the specific places wherein there are a lot of COVID-19 cases victim? However, their personal information should be protected thoroughly. A different approach can be applied to naming when it is necessary. The authority is responsible for tracking them can give each one of them a different conceptual identifier so that naming could be handled confidentially. That particular identifier is the same as a number assigned to the Internet of Things devices. This is what we call as the blind ID, which will enable one to prevent hackers from inferring the identity of the information corresponding to this number, even if they can secretly obtain this identifier number. Now, fifth issue is confidentiality. Confidentiality is really important. The privacy information of the confirmed cases, either person suspected of infection or a person in need of management, should be encrypted and stored using a secret key. That secret key is granted separately for each individual. With a large number of CDCs distributed around the world and enough people to manage per CDC, the platform should provide a security management services that will allow individual to use different secret keys for each individual. Then, scalability. The platform should provide real-time disclosure services for the COVID-19 related tracking information to any CDC as part of the network, and anyone in the world in the same way as we are using our DNS or the domain name system, which provides name address conversion services in HTTP communications in real time. It is somehow a prerequisite that the platform should be able to accommodate enough people to manage per CDC as well as a larger number of CDCs distributed around the world. If the system will be implemented, the data structure that the platform handled must be concise and straightforward so that the scalability of the system can be satisfied. Last issue is the latency. Currently, the person gets to configure to figure global 19 cases out based on data, which will be provided by the World Health Organization. So we depend on the World Health Organization or the WHO. In addition, they usually get to know global COVID-19 case trend based on the data that were being released by WHO. However, it takes time for them to gather reliable and comprehensive data, and the quality of service to the user should be taken into consideration. It should also go beyond the official statistical data presentation method that the WHO is using. It is actually necessary to send a query on an individual basis. If I will be the node, if I will be the user, I could just simply send query and automatically the application should be replied to me in a real time. That's the quality of services should be handled. The time that it takes to complete the query reply process in a global public services must be faster to satisfy the quality of the services to the users or to each part of the network. This paper, since it proposed the SDNC or the Software Defined Networking Controller centric global public platform to monitor and track information for the COVID-19 relevant people who are infected and suspected and provide real-time information disclosure services to World Wide Web CDCs and regular users. This paper will cover up those issues that I emphasized a while ago. The design of our platform aims to ensure confidential authentication services using different kinds of keys, which will be handled by the DP-Hellman secret keys for real-time information delivery. This paper also argues that the world must use the same platform or a universal platform to handle monitoring and tracking of COVID-19 patients or COVID-19 related cases. This paper also seeks to satisfy system scalability and reduce query reply latency or speed or the faster time to satisfy the query mechanism. wherein the application accommodates can handle a bigger or larger number of worldwide CDCs and person in control per CDC. It works. Knowledge of the quantity and quality of apps related to coronavirus disease COVID-19 is lacking. Perform an observational cross-directional descriptive study of all smartphones associated with COVID-19. Between April 27 and May 2, 2020, they searched the App Store or iOS and Google Play Store Android for COVID-19 apps. The search data were classified into the following categories: either news, general information, self-diagnosis, contact tracing, notice to contacts, notification of closed cases, awareness, helplines, monitoring of clinical parameters, recording of symptoms and treatments, and messaging with healthcare professionals. Looking on these particular parameters, we can see that almost all of the applications available in the internet are more on um, not proactive but a retroactive type of notification. So everyone will be notified right after they were close in COVID-19 patients. What is important here is we can mitigate or we can minimize the effect of COVID-19 or the infections if we have a real-time notifications such as these particular apps. At the same time, they concluded that the app's most common purposes are providing informations on the number of infected, recovered, and deceased, which are after, or as I was saying, it's more on retroactive. Recording symptoms and contracting tracings rather than real-time tracking and monitoring COVID-19 cases. Center for Health Security at Johns Hopkins announced a national plan to save lives. To reduce COVID-19's burden on our healthcare system, is strict social distancing measures, and confidently make progress towards returning to work and school. This could only be possible if we have a concrete solutions with mitigating or possibly eliminating COVID-19. They suggest also that the United States must also implement a robust and comprehensive system to identify all COVID-19 cases and trace all those contacts of each identified cases. According to their estimation, if one person spreads the virus to three others, the first positive case can turn into more than 59,000 cases in 10 rounds of infections, which is quite relevant. So if we can actually monitor COVID-19 infected persons at first, we can at least minimize this kind of infections or with this kind of relevant numbers of cases around the world. COVID-19 is already spreading through communities across the United States. Therefore, a case-based intervention approach will be possible to achieve for COVID-19 without a new national initiative that combines a massive expansions of rapid diagnostic tests with the adoptions of new technologies to case identifications and contact tracing in each states. To manage COVID-19 epidemics from now on, communities in the United States needs the following. First, rapid diagnostic tests for all symptomatic cases or those with reasonable suspicions of COVID-19 exposure. Then, the ability to trace all contacts of reported cases. To accomplish this goal requires actions that the federal, state, and local governments and the other organizations must take to stand up for those capabilities as quickly as possible. Moreover, the second solution to monitoring and tracking issues is really urgent. Countries have been employing a variety of means to enable contact tracing. Actually, in Israel, legislation was passed to allow the government to track people's mobile phone data with suspected infections. Since they have the law, the government can easily monitor or track people's mobile phones data and try to disseminate those informations over their network. At the same time, in South Korea, the government has maintained a public database of known patients, including informations about their age, gender, occupations, and travel routes, which is somehow is a public information that can be gathered all throughout the internet. In Taiwan, Medical institutions were also given access to patients' travel histories, and the authorities can track phone locations for those persons' data for anyone under quarantine without their consent. Furthermore, last March 2020, the Singaporean government released a mobile phone app which is called Trace Together, which is designed to help health officials track down exposures after an infected individual is identified. So more of these applications are more on tracking individual which is already classified COVID-19 patients. While Singapore's Trace Together app protects users' privacy from each other, it has a serious privacy concern concerning the government's access to the data. This documents discusses these privacy issues. Issues are as followed. Appropriate privacy trade-offs can be obtained so that people can be willing to endure for the sake of public health. With sufficient computational resources and the use of possibly cryptographic protocols, app-based contact tracing can be accomplished without completely sacrificing privacy. This application's use is limited because it relies on direct contact tracing using Bluetooth proximity networks without using any location data. This current technologies such as Bluetooth proximity networks are currently used by different other countries. But these Bluetooth proximity networks cannot apply to a specific geolocation process. Even though they begin to use private messaging system, increasing privacy remains as future work. They agreed that there is a long way to adopt a contact tracing app globally or universally. For example, the scalability of the data structures used in the server may become a major issue when the number of infected individuals and public users rises, which is currently happening through surge on different variants that are being issued all around the world. This tracking system can also use blockchain-based Ethereum, smart contracts, and oracles to track reported data related to the number of new cases. It is being proved that using a blockchain technology or blockchain-based type of technology can somehow protect a data against intrusions. The track reported data related to the number of new cases, deaths, and recovered cases obtained from trusted source. Numbers such as positive and negative tests, patient hospitalized, deaths, hospital beds occupied, ventilator shortfalls, and other things. It allows the official and public to track the progress of COVID-19 in real time. However, this number pose a major problems as decisions based on such data are often imperfect and incomplete. Thus, tracking apps introductions become necessary and valuable to prevent the spread of this virus and maintain data quality and integrity. Furthermore, tracking valid data is vital to monitor the progress of the pandemic. Right now, tech giants, researchers such as Apple and Google, and healthcare officials started using contact tracing mobile apps that uses Bluetooth-based proximity tracing or geolocation tracking functionality to track COVID-19 cases. However, the data available online may not be perfect as it. It is susceptible to data manipulation, intrusions, and even hacking. Such information that we're currently handling by their repository are really exposed to manipulations. They argued that the blockchain technology can somehow revolutionize the way to track COVID-19 cases. They focus on the benefits of implementing a blockchain-based solutions over a traditional centralized solution in various aspects, which includes data handling, quality assurance, fault tolerance, and some other part. It also introduces immutability and data provenance while removing a single point of failure in the system. Even though blockchain has great potential in combating the COVID-19 outbreak, a critical challenge must be considered. We all know that the tracking data traffic becomes bulky as the number of transactions increases every day. And this is the main loophole if we use pure blockchain. Every node on the blockchain has to store all validated transactions. And at the same time, this becomes an obstacle that as there is a restriction on the block size and time interval used to create a new block under a technology of blockchain. Current blockchain platforms process only a few transactions per second. So if we look on millions of instructions per second, it would take time before a new block will be created. Since our target is a real-time notifications of COVID-19 patients, this will be our loophole. This will becomes a problematic as millions of transactions are needed to be processed in real time. Since the block size is limited, this causes some transactions to be delayed so much if we just rely on blockchain. As a result, this latency issues makes the blockchain-based tracking platform not suitable from our point of view in terms of scalability and latency. The latency issue makes it difficult to realize the full applications of blockchain-based tracking platform, especially in COVID-19. This lack of scalability is not such an issue for only private blockchain network ever since the node in the network are purposely designed to process transactions in environment of trusted parties such as CDC, which makes sense of the business wide. So basically, this problem will yield behind the scalability issues. Legacy transactions networks are known for their ability to process thousands of transactions per second. For example, if we're dealing with the blockchain in terms of COVID-19 patient, it is capable of processing of more than 2,000 transactions per second. The two largest blockchain nowadays, which is the Bitcoin and Ethereum, however, are far behind when it comes to transaction speed. While the Bitcoin blockchain can only process 3 to 7 transactions per second, Ethereum can handle approximately 20 transactions in a second. This is too far from the millions of transactions that we're going to deal in the future applications of this in terms of COVID-19 trackings. In addition, blockchains demands high bandwidth and expensive computational power, which is quite a problem with in terms of those countries which has a problem financially. Therefore, blockchains are not completely suitable for most resource-constrained IoT devices meant for a smart cities. However, a blockchain-based solution has been tried to solve the security and privacy problems of medical data. In this area, blockchain-based solution could really be considerable. A modified blockchain model was proposed suitable for IoT device to rely on its distributed nature and other additional privacy and security properties of the blockchain network. That solutions make IoT application data and transactions more secure and anonymous over a blockchain-based network. Also, blockchain can help create a single database to collect data during clinical trials and allow patients data security. And they combine the Internet of Medical Devices, IoMT, applications and blockchain technology in healthcare for patients data analysis and research about adequate medications. A remote patient monitoring system can also be beneficial using IoT devices, which has been proposed. The paper presents the benefits and practical obstacles to blockchain-based security approaches, focuses on IoT and remote patient monitoring. In another reference, they present a holistic vision of IoT-enabled smart communities utilizing various IoT devices, applications, and relevant technologies. We can see the significant effect once we combine all those IoT-enabled type of applications, which can help combat, alleviate, and minimize the effect of COVID-19 in our society. This could have the potential to be a true breakthrough in efforts to control and fight against the current pandemic situations. IoT is an emerging field of research along with the ubiquitous availability or smart tech analogies. As well, As increased risk of infectious disease spread through the globalizations and interconnections of the world necessitates its use for predicting. From the perspective of monitoring and tracking to prevent COVID-19, their design is to implement a remote patient monitoring use case with the e-health domain very relevant to COVID-19. Patients in home isolation and enforcing the quarantine. This could either be like they could easily monitor patients even they are not even they are far. So the risk of exposing to COVID-19 virus could be at least minimized within this type of technologies. It is also expected that the smart cities and intelligent transportation system technology will also host a range of data-driven services together. So we can actually improve the transportation system technology by considering also the safety of our customers. It might deploy sensors to assist in the early detections of such COVID-19 outbreaks. These sensors will be the participant of our network configuration to send data or information along with other sensors connected to the internet. This article also focuses on proposing a novel architectures and several use cases that can be developed to create a what we call the smart city and ITS inspired data driven system, which can be also used to effectively and timely enforce social distancing, community measures, and optimize the use of resources in critical situations. This paper scope is as follows. First, we design a global platform focusing on monitoring and tracking to prevent COVID-19. So in real time, this platform will be used to monitor and track COVID-19 patients. A virtual Internet of Things or BIoT node can be confirmed case or possible a suspected infection. The CDC will work on possibly installing virtual BIoT nodes in the form of application software on each of the smartphones as part of the network configuration. CDC also controls the BIoT nodes for a list of people who need monitoring and tracking in its control range. While on the other hand, the SDNC is a centralized center that collects location-related information sent from this node, the BIoT nodes, under all of the distributed CDC's control. Each of the BIoT node is responsible for updating locations-related informations into the SDNC. As a user, an individual's BIoT's secret key is created and provided by its CDC. Each of the BIoT's node uses the secret key to update locations related information to SDNC. The SDNC also generates and uses what we call as the secret key in real time when it receives the update message from each of the nodes. CDC can also monitor the location related information about the BIoT nodes under its control. Unlike the BIoT nodes, the ordinary user can only obtain limited information from the SDNC without a secret key. And an ordinary user can reach SDNC and obtain necessary information except for privacy-related data even, though the user does not maintain any security associations. Somehow, this scope will somehow solve those issues that are being discussed a while ago. Now, the parameters all throughout this paper will be discussed on the next chapter or the next part of these presentations. So that's all for now. Thank you.